Hi, I wanted to do a video about managing engorgement postpartum and helping prevent clogged ducts and in turn mastitis. So for me, it's a full-time job to keep my boobs soft postpartum and as soft as possible. When the milk comes in, your boobs can get really hard. And when they're hard like that, they're gonna predispose you to some clogged ducts. And so you wanna keep the ducts, you wanna keep the milk flowing, you wanna keep your breasts as soft as possible. And so I'm gonna show you some techniques that I've been using, techniques that we use in the clinic to help keep the breasts soft and really help prevent clogged ducts. Now, if you have clogged ducts, these can be magical tools to help you relieve yourself. But you also might want to touch base with the pelvic expert PT that can really help you with your own clogged ducts as well. So here we go. Set the phone there. Okay, so I'm gonna grab my boob, and I get my most clogged ducts on the side here, okay? So you can do this massage while your baby's latched or when you're pumping, okay? If this is a recurrent problem for you, we of course recommend working with an IBCLC to help a lactation consultant. But okay, so you're just gonna take your breasts. Different sizes are gonna require different grips, but I'm gonna work my thumbs from the top, all the way from the top down towards the nipple, okay? So I'm just kind of like alternating, pressing down towards nipple. I also will come out here and then I'll do some circular motions with my thumb and just work it towards the nipple. My outer and top tend to be the hardest. And same thing out here, outer working down towards the nipple. You know, this is easier if you if you are pumping or the baby is latched. I cannot get my baby to drink enough to like ever clear these things out. So I am having to pump a little bit in the early days, although I'm not wanting to affect my supply at all or increase my supply. So I'm trying to just pump the bare minimum to just give myself some relief so my boobs aren't so hard and so engorged. Okay, so you're just watching me massage here. I can also come to the side and I'm just like working it. I guess this is a little up and down and then a little circular motion as well. So working this whole side of the system. And I pretty much just do this until I feel it soften and let go. You know you'll start to get some clogged ducts when you feel like these hard nodules. And you always wanna, like, when you give compression to those ducts, you push on them, and it's not that hard, okay? So like if that was 100%, we're talking like maybe 25, 50%, but you're still working it, and they're sensitive, so it might feel like you're giving more pressure. But you give compression and then you let it go. You give the compression, the circular compression, and then you let it go, circular compression, and then you let it go. And that is just gonna help you really relieve your engorgement. It's really gonna help prevent the clogged ducts. As you can see, it will help you express milk as well. But that is what I got for you guys. So I hope that is helpful in helping you relieve your engorgement, helping prevent the clogged ducts, and definitely helping prevent the mastitis. If you need help, we can definitely help you. And we would love to be able to help you soften your breasts so you're not feeling that engorgement, and in turn not have to deal with the clogged ducts, because that is no fun. But again, working with an IBCLC lactation consultant can definitely help you a ton, and we have a list of resources. So if you reach out, we can always direct you in the right way for that. So all right, take care, guys.